A minute each.
Thank you very much.
Away you go, Senator.
Thank you so much, Cathaoirleach, and for the clerks for allowing us the opportunity to raise this important issue. And I welcome Minister Daly to the House. Dementia is an issue that affects every community throughout Ireland, and there's an estimated 55,000 people living with the condition, with this figure expected to more than double over the next 20 years. People with dementia need a wide range of community services that will support them from the moment of diagnosis and throughout their journey. We are all aware of the significant gaps that exist in these vital services and supports in every county in Ireland. And I now hand over to my colleague, Senator Maura Devine.
And we as a group, we worked very hard together, and today making a decision to focus on the estimated 4,000 people who develop dementia each year. That's at least 11 people per day. They're not my estimates, rather they come from the HSE Understand Together information campaign. Each one of these 11 people and their families need access to a dementia advisor to support them as they embark on their journey with dementia, which can last years and even decades. And the frightening terror when somebody is given that diagnosis. I think a lot of us in the group have medical backgrounds, and we've been involved with direct hands-on with that. You might ask, what is a dementia advisor and how they support people? A dementia advisor works with people with dementia and their families, a highly responsive and individualised support to the person with dementia from diagnosis, the moment of diagnosis onwards, and includes their carers. They help people to connect with dementia supports and services in the areas. Yet there are only 8 of these throughout Ireland. Access is on the basis of a postcode lottery. As a member of the All-Party Rock is acutely aware of the provision, the lack of equity, and our budget submission, we strongly advise the Government to provide funding for an increased allocation of dementia advice throughout the country. Senator. And this is what this is focusing on, Minister.
Thank you, Senator. Senator Swanwick, you have a minute.
Thanks to Senator Kelleher for allowing me to speak this morning. A recently published independent report, evaluation of the Alzheimer's Society of Ireland Dementia Advisers Service report by UCC, which was commissioned by the HSE's National Dementia Office as part of the implementation of the National Dementia Strategy, highly recommended an increase in the number of dementia advisers to meet the increasing demand as a result of the increasing prevalence of dementia in this country. And the report also recommends development of the service to achieve national coverage. This independent evaluation is the first external evaluation of the Dementia Advisor Service in Ireland, and it has provided evidence of overall high levels of satisfaction with the service. People living with dementia and their carers and health and social care professionals reported satisfaction with the information, advice, peer group and signposting of services provided by the service. The report found that there are challenges with equity of access to dementia advisor service across the country, and a large number of people with dementia, including in Roscommon and Mayo, and their families simply cannot access the dementia advisor because of where they live. I'll hand over to Senator Kevin Humphrey.
This is a vital support for dementia, people suffering from dementia, and for their families. So, Minister, I'm going to get to the nub of the problem and ask you very clearly, Minister, will you ensure that the funding for an increase in the number of dementia advisers will be included in the upcoming 2019 HSE service plan? Because nothing less is needed for these families. Further, can the Minister commit to building up a national network for dementia advisers so that there is one in every primary care unit across the country? We have seen the changes first-hand at how a dementia advisor can help families, can help the sufferers, and it is the vital necessity that we provide this service right through the country. So, Minister, I re-echo the quick question. Will you ensure that the funding is put in place in the 2019 HSE service plan to ensure that the dementia advisers are there, easily accessible for people that are diagnosed with dementia?
Thank you very much, Senator. Thank you, 3 senators. Minister.
And thank you to the senators for raising the issue. As a response to the challenges facing people with dementia and their families and carers, the National Dementia Strategy was launched in December 2014. The strategy contains 35 priority and additional actions, and its implementation has been led by the National Dementia Office in the HSE. Plans are progressing to further implement the Dementia Strategy through the National Dementia Office, including in the area of diagnosis, post-diagnostic supports and care pathways. In 2016 and 2017, the National Dementia Office partnered with the Alzheimer's Society of Ireland on a project to map dementia-specific community-based services and supports. It provides a useful snapshot and baseline study into what, where and when dementia services are being offered. The study has also been used to inform a service finder hosted on the National Dementia Office's website. This allows people to search for dementia-specific community services in their area. There are gaps in access to services and a large variance in what services are provided across the country. The National Dementia Office has met with senior HSE officials in each community healthcare organisation region to highlight gaps in each area and to develop local action plans to improve service provision. The National Dementia Office has also developed a needs analysis framework to support local dementia service planning and development. This framework is a mechanism to help the Office direct time, energy and resources into dementia care that most appropriately meets the needs of people with dementia. It will be used to make dementia service development more responsive and consistent across the country. The National Dementia Strategy calls for the HSE to consider the provision of dementia advisers based on the experience of demonstrator sites. At present, there are 9 dementia advisers across the country. 8 of these are hired by the Alzheimer's Society of Ireland. The HSE has contributed $400,000 in each of 2017 and 2018 towards the service. An evaluation of the Dementia Advisor Service was published on the 26th of September. It recommends the continuation and expansion of the service to ensure equity of access countrywide. The Government welcomes the positive results of the evaluation and will continue to work to improve service delivery for people with dementia. Dementia advisors are not the only community support being given to people with dementia and their families and carers. The Department of Health has secured funding through the Dormant Accounts Fund for numerous projects to improve care and supports for people with dementia, including the delivery of post-diagnostic supports, a dementia diagnostic service for people with intellectual disability, a national network of memory technology resource rooms, the development of a national dementia registry, the national rollout of a dementia training programme for HSE home care staff, the development of dementia resource centres, funding for a dementia community activation coordinator, and community support projects for people with dementia. In terms of the Senator's request to increase the number of dementia advisers, the quantum of services to be provided by the HSE is being considered as part of the HSE's 2019 National Service Planning.
Thank you, Minister. Would you like a supplementary, Senator?
Thank you very much, and thank you, Minister. I have to say I'm really disappointed that all you can say is that dementia advisers are only being considered, not committed to. This is after several budget submissions on our behalf and after a very clear evaluation by UCC. The National Dementia Strategy is welcome, but it is not going far enough and it's not going fast enough. I think it's time for the Government to make good on dementia commitments and recognise the emergency that is facing people with dementia and their carers in Ireland today. People feel that whilst they may be getting heard by the Government and sympathetic members of the Oireachtas, that hearing and listening is not being matched with real money, real public investments, real services for real supports that people with dementia and their carers are simply crying out for. For supports and services like a national network of dementia advisers, as you can see that there is very strong cross-party support for a real uplift in dementia-specific home care, for day supports, for Alzheimer's cafes and the range of supports that are needed in every county in Ireland. As you know, Minister, in Cork, for example, where we both are from, according to the Alzheimer's Society of Ireland, there are approximately 4,000 people with dementia, 12,000 carers, and an additional 500,000 is needed in 2019 to bring it up to the minimum level. That is why ASI, the Alzheimer's Society of Ireland, is holding an emergency dementia summit next Wednesday, which will be followed by an AV room briefing by the all-party group on dementia. So, Minister, there is an emergency and an urgency to act, and I'm disappointed by your response today.